Welcome to the YouTube channel Dr. Mai, sharing medical knowledge. Today, we're diving into an important yet often misunderstood medical condition called vasovagal syncope. This condition affects people of all ages and can cause sudden fainting episodes, but it's not as scary as it might seem once you understand it better. Don't forget to subscribe to the channel, like the video, and leave a comment below. Your support helps us bring more insightful topics to this channel. What is vasovagal syncope? Vasovagal syncope is the most common type of reflex syncope. This occurs when the body's normal mechanisms to control blood pressure and heart rate are disrupted, leading to a sudden drop in blood pressure and heart rate. When this happens, the brain doesn't receive enough blood, causing a brief loss of consciousness, what we typically refer to as fainting. Often called neurocardiogenic syncope, vasovagal syncope happens automatically and is beyond your control. It involves a reflex in the autonomic nervous system, the system responsible for bodily functions like heart rate, blood pressure, digestion, and more. While passing out can be alarming, vasovagal syncope is usually harmless and rarely indicates a serious underlying condition. But understanding it is key to preventing injury during fainting episodes and addressing any potential risks. Who is at risk for vasovagal syncope? Vasovagal syncope is surprisingly common. About 1 in 3 people will experience it at least once in their lifetime. It can affect people of any age but is particularly prevalent in younger individuals. In people under 40, vasovagal syncope accounts for 85% of fainting episodes. In older adults, the figure is lower but still significant, with vasovagal syncope contributing to around 50% of fainting incidents. However, not everyone is equally likely to experience vasovagal syncope. For example, individuals with autonomic nervous system disorders, such as Parkinson's disease, are extremely unlikely to suffer from this condition because their nervous system doesn't function in the same way. What causes vasovagal syncope? The key to understanding vasovagal syncope lies in the autonomic nervous system, which controls involuntary functions like heart rate and blood pressure. This system has 2 main branches. 1. The sympathetic nervous system, responsible for the fight or flight response. This system prepares your body for action by increasing heart rate and blood pressure when needed. 2. The parasympathetic nervous system, known for the rest and digest functions. This system helps the body relax, digest food, and maintain normal bodily functions. The vagus nerve, one of the key nerves in this system, regulates heart rate and blood pressure. Vasovagal syncope occurs when the vagus nerve becomes too active, leading to a sudden drop in heart rate and blood pressure. This overreaction is often triggered by specific stimuli, and when the brain doesn't get enough blood, you lose consciousness. Common triggers for vasovagal syncope. Vasovagal syncope is often triggered by external factors, and it can happen to anyone, even in seemingly mundane situations. Some common triggers include seeing blood. Many people faint at the sight of blood or during medical procedures involving needles. Stress or emotional distress. Intense emotions such as fear, anxiety, or shock can prompt a fainting episode. Prolonged standing. Standing for a long time without movement can cause blood to pool in the legs, lowering blood pressure. Fatigue or exhaustion. Overexertion or standing for extended periods can cause a person to pass out. In addition to these, certain situations that involve a reflex can cause syncope. Carotid sinus syndrome. Pressure on the carotid artery in the neck, often from wearing a tight collar or turning the head sharply, can trigger fainting, especially in men over 50. Situational syncope. Fainting that occurs during specific actions like urination, bowel movements, coughing, or after a large meal. Symptoms leading up to an episode. Before a fainting episode, many people experience warning signs known as prodrome. Recognizing these signs can help prevent injury. The most common symptoms, which usually last 30 to 60 seconds before fainting, include lightheadedness or dizziness, nausea, a sudden warmth or wave of heat, pale skin, sweating profusely, yawning, a slow pulse. Once vasovagal syncope starts, You may lose consciousness and fall to the ground. Usually, you're unconscious for only 10 to 15 seconds, and recovery is rapid. Other symptoms during or after the episode may include eyes rolling back, twitching, loss of bladder control, dizziness or headache after regaining consciousness, sweating or an urge to use the bathroom. Diagnosing vasovagal syncope. If you've fainted unexpectedly, it's important to seek medical evaluation. A healthcare provider will likely ask about the circumstances leading up to your fainting episode and any other health changes. They may conduct several tests to rule out more severe conditions, including blood tests, to check for conditions like anemia, electrocardiogram, to monitor heart activity, electroencephalogram, to measure brain activity and rule out seizures, tilt table test, a diagnostic test where the patient is tilted upright to simulate the effects of standing. How serious is vasovagal syncope? While vasovagal syncope is rarely dangerous on its own, fainting can lead to injury, especially if you fall. It's also essential to rule out more severe causes of fainting, such as heart or neurological problems. Therefore, seeking medical advice is crucial if you faint or experience recurring episodes. Treatment and prevention. In most cases, vasovagal syncope doesn't require long-term treatment. However, some strategies can help you manage or prevent episodes. Medications. For those with frequent episodes, certain medications can help regulate blood pressure or heart rate. Pacing devices. In rare cases, a pacemaker may be recommended to regulate heart rhythm. Recognizing symptoms. Learning to recognize the early signs of an episode allows you to sit or lie down to prevent falling. Anti-syncope techniques. Specific physical maneuvers can help prevent fainting by maintaining blood pressure. These include leg crossing or squeezing a rubber ball. Does vasovagal syncope go away? Most people will only experience vasovagal syncope once in their lifetime. However, for some, especially those with particular triggers, it may be a recurring condition. With the right knowledge and preparation, it's possible to manage the condition and minimize its impact on daily life. When should you see a doctor? You should consult a healthcare provider if you've never fainted before and experience your first episode. You experience several near-fainting episodes. You have a history of vasovagal syncope, but the frequency or severity of episodes increases. A note from Dr. Mai. Living with vasovagal syncope can be challenging, but it's manageable with the right guidance. Knowing your triggers and recognizing the symptoms early can help you lead a fulfilling, active life. If you have concerns, don't hesitate to speak with your healthcare provider. Thank you for watching. Don't forget to subscribe to the channel, like the video, and leave a comment below. Your support helps us create more valuable content for you. Stay healthy and informed.